So for my video, I decided to talk about Botox. I'm sure that you're thinking that Botox is just used for wrinkles, but actually it is used for so much more. Botox is short for a neurotoxic protein called botulinum toxin. It is produced by the bacterium Clostridium botulinum. It is found in many natural settings, including soils, lakes, and forests, and it is also found in the intestinal tracts of mammals and fish and in the gills of some crabs and shellfish. When it is naturally occurring, instances of this Clostridium botulinum are not very harmful and they are nothing to really worry about. Botulinum toxin is actually one of the most poisonous substances known to man. A single gram of it could kill as many as 1 million people. However, in high concentrations, Botox can result in botulism, which is a severe life-threatening illness. Now you may ask, what is this bacterium and what does it do in our bodies? And why would I want it in my body? Well, it prevents the release of the neurotransmitter acetylcholine from reaching axon endings at the neuromuscular junction, which prevents the targeted muscles from contracting, which in turn causes flaccid paralysis. Another question that came to my mind was, is Botox a live bacteria and can it reproduce? Botox that is used for the cosmetic procedures as well as medical reasons to have it done on your body are actually injected as a pure protein, meaning that there is no bacteria and that it cannot replicate. Botox is injected in the skin and not in the bloodstream, and it is slowly metabolized by the body. What can Botox be used for? Although Botox is predominantly used to fix the fine lines and wrinkles on your face, it can also be used to treat a wide variety of medical conditions, as well as cerebral palsy, severe primary axillary hyperhidrosis, which is excessive sweating, as well as post-stroke upper limb spasticity, which I myself have actually experienced how they use this Botox on post-stroke patients. So I'm a CNA and I take care of one of my patients is an elderly woman and she had a stroke and she cannot use the entire left side of her body. And so I saw a doctor do one of these injections, and within a few days her arm is so much easier to move. She has so much more mobility, less pain, less stiffness, and it really does make a difference. It's not permanent and it lasts around 3 to 6 months for each injection. So every 3 to 6 months you have to go back and get more injections. For each area that they treat, it ranges from $350 to $500. In small amounts, Botox is very safe, but it does have a lot of side effects, and some of those common side effects can be muscle weakness where it was injected, trouble swallowing for several months after treatment, dry mouth, headache, pain, swelling, bleeding, bruising, drooping eyebrows. Overall, the Botox can help medical conditions and it is fairly safe as long as it is used in small amounts and as long as you go to a trained professional who knows how to inject. But in larger amounts, it can be really deadly. If y'all have any questions, feel free to ask them. Bye.